Hey nursing friends, it's Irma back again. I've just been in the mood, I guess, just to make videos. Ever since I passed Nclex, I've just been okay. What can I tell other nursing graduates who are waiting to take Nclex, maybe for the first time, second, third, however many times? And I just want to give you tips for your Nclex day that I did differently that helped me this time around to be successful. Again, I have on my phone some tips that I wrote down. Basically, my first tip is even when you're registering to take your NCLEX, after you get your ATT or authorization and you paid and everything's fine, and you can go into Pearson and select what days you want to take the test. So, the first time I took NCLEX, I took it at 8 in the morning. Um, I picked the first time a day in October, like middle of October, just because I wanted at least 3 weeks to study, maybe a month to study. But since my ATT was a little late to come to me, I had to hurry up and pick a date, so that's why I picked that day. And so I took it at 8 in the morning. Um, but knowing myself, I should not have done that. I know I'm not a morning person, and this test is super important. So what I did the second time I got my ATT, I decided, you know what? I didn't know you could take a test in the afternoon. I didn't know that until one of my friends told me that she took her exam around noon. And I was like, well, next time I'm going to find a test day that is in the afternoon because I like to wake up and be wide awake and eat breakfast and just calm down. So I picked the time and it was at 2 p.m. this time, and I was like, oh, that's perfect. I can have breakfast, relax, and maybe even eat some lunch. So my first tip is to pick a test time at that you know you'll be the best optimal, you have the best optimal performance. If you're a morning person, then choose morning, and if you're really anxious to do it in the morning, do it in the morning. But if you want to wake up and relax, you can pick what day you test and what time you test. Do it when you are ready and you feel really, really prepared. And I was kind of thinking when I last took my NCLEX, like last week, I was like, well, am I ready? Am I ready? Should I change the test? Should I change the test? And then I was like, you know what? I don't want to take it before Christmas, like around this time today, or like say yesterday or today or tomorrow, because I'm not gonna enjoy my holidays, and you're gonna be thinking about the NCLEX, and I don't want to be like that. So I decided to take it when I took it, which I believe was the best time for me. That's my first tip. My second tip before going into NCLEX on the test day is to make sure you eat. You need to eat something, nothing too sugary, not a lot of coffee. You need to eat some carbs for energy. I ate some oatmeal and some juice for breakfast. And for lunch, I didn't really have a lot here, so I just ate a sandwich and yogurt and some water. That's what I ate because I hadn't gone to buy groceries, so I have to just stick to whatever and hope my stomach wouldn't growl and I would stay there the whole 6 hours. I hope I didn't do that, but definitely eat, drink, and also before you go to the test, of course, you want to use the restroom before. Yeah. So my next tip, this is kind of not controversial, but people say you should do this or you shouldn't do this before taking your test. So what I have here is number 3, review and question mark. And I don't mean you want to sit there and read your whole Saunders book before your test. No, that's not what I say about review. The only thing that I reviewed before taking my NCLEX on NCLEX test day was this like Nclex study guide. Like it simplified everything, and it was just a last minute exam cram type of sheet. And if you want me to email it to you, you can private message me on YouTube here and send me your email, and I can email it to you because it is awesome. and it's just like an exam cram sheet. You can even Google exam cram and Nclex test day sheet, and it's just like 10 pages of just simple. Um, it gives you signs and symptoms of diseases that are like characteristics of that disease, and like it just gives you lab values and drug levels and common medication endings. Just quick stuff, nothing too in depth, just simple. A simple review that really it did help me, calm me a little bit, knowing okay, I read that, okay, yes, I know that, yes, just to keep it fresh in my mind. So that's another tip. Another tip I have is during the test, don't be afraid to take breaks. When I first took my Nclex, I was nervous to take breaks because I wanted to hurry up and finish the exam. I had 100 emotions going through my mind, but um, since I finished my Nclex so fast, I was already prepared to take a break in my first hour. Like right after I hit 75, I was gonna take a break, but I didn't get the chance to. But I was planning to take a break every hour. So that's what I would do during my exit test. I would take a break every hour, and it helped me. Um, Another very important tip I put. This is really important to me. I think it helps. Like I said, in the first time I took my Nclex, I was set on the number, and I was like, okay, if I go after 75, like that's it, I failed, I'm done. I'm gonna, so whatever. So instead of thinking on the number and thinking quantity, there is an option during the exam to hide the number. It's going to be in the corner, right? The top corner. When you take a test, it's going to be up there. And you can click it to hide the number or unclick it to check what number you're on. On my first exam, no lie, every question I was like, ding, 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 ding. I should have just like shut it and hit it and not focused on it, but I was so focused on that number, and I should not have been focused on the number. So if you want to ease your anxiety and don't even care what number, just focus on what's in front of you and take your time. Just hide the number. That's another tip I have that I would do. Like I said, focus what is in front of you. Every question, all the words matter. If they say the patient, an age, gender, a previous disease history, they had just had an accident, that they're post-op, how many hours post-op, fresh post-op, 2 days post-op, just any little detail that is important. They wouldn't tell you that if it wasn't important. The next tip I have is focus. Okay, next tip I have is know what is normal so you can differ abnormal. So this basically during priority questions or select all that apply questions. They're going to give you priority questions, right, for patients you can see, and most either 2 or 3 out of the patients are showing symptoms that are normal for what they are admitted for, right? So the emphysema patient, short of breath, well, that's normal for them, right? The acute renal failure patient is gonna have the high levels, right? But what you're looking for is something that is ABC related, super priority respiratory, right? Something with airway, something with breathing, something with shock. If they're showing severe symptoms, if the patient is showing severe right now, present time, that is the first patient you want to see. So that really helps me because you can eliminate at least 2 and bring your options to choose from to by 50% if you eliminate, like, okay, well that's normal, that's what you're supposed to be seeing, I'll deal with that patient after my priority patient. That really helped me. Also during select all that applies, because a lot of my select all that applies were based on conditions. A lot of the conditions on every system, that you're expected to see. So if you know the diseases and you know what is normal, you can differ what is abnormal. And that is why the core content is so important to know, that the test strategies really wouldn't help you there. Only elimination and knowing the content would help you in that situation. Also, for meta questions, the way I tackled the med questions during my exam, if I had no clue what that med was that they showed me. My first question was a med question, and I was like, really? Really? You gonna do that to me, Nclex? And it was also like, I can't tell you specifically, but it was a content that I was not very strong in. So the way that I tackled this question is I looked at the answers after I read the question, and some of the answers could give you hints kind of what type of medication it was, because it was it was like the patient, I'm just saying broadly what the question was, like the patient is taking X medication, and it was generic because I don't do brand names anymore. The patient is taking X medication, and you observed so and so. Which one of the so and so observations would you report to the physician? And all four sounded like, oh, I should report that one, but that one, but that one. So by the observation that I observed, I could tell, okay, this is this class of medications. I definitely want to report that because that can lead to this and that can lead to that. And just critically think your way, you know, that really helped me. The last tip kind of that I have is focusing on alternative type questions and how I did these, because during my Nclex the second time, let me talk about the first time. During my Nclex the first time, when I got to select all that apply, I was so scared to even answer these. I kind of freaked out when I got to these alternative types, select all, putting in order, an image question. I was like, oh my god, a hearing, like listening question, a EKG strip question. So how I tackled these was, with select all that applies, like you can look up videos, you can see, you kind of go through it as a true or false. You read the question. Is the first option, is that true or false? Yes or no? Yes, no. And in all selects that apply, you're gonna pick at least two, sometimes all of them. When I was practicing with Hearst, one time or two times I had to choose all of them because they were all correct and they answered the question. So basically, just take your time and read the question. Reread the question. You want to read the whole option that you may or may not choose, because even if one section is wrong, you're not going to choose that. And the putting in order sequencing questions, really take your time. I had two of those on my Nclex, and I mean, there's so many skills that you learn throughout nursing school, and they gave me two basic nursing skills that you need to know. So I knew I had to get these right. I knew they were really important. I knew I had to pass these and get them right to move on to get higher level questions. So those I really took my time on, and I even used like my own body to like, am I doing this right? Like, because I can't tell you what it was about, but if you read it and you can move your body parts and just think about it out loud, or even write it out, use your paper, write it out. Like, take your time. I think that is all the tips that I have right now that I can think of. What I did when I was going into my Nclex for the second time, I was in my car. I got there early so I could sit in my car and say like last minute prayers. Just be positive, like I've been saying in my past videos, and just believe in yourself and walk in there knowing that this test, yes, it's gonna get you anxious, but this test is the last test you will ever have to take for the rest of your life. Like, that's how I went in there, and I was like, after this test, I'm going to be a nurse. After this test, your dreams will come true. Like that's how I went in there. And also taking the test, I kind of told myself, okay, this test will determine your future. This question relies on your future. This test relies on the job that you have. So yes, it's a lot of pressure, and it was very, very anxious going in there second time. Yeah. But I just felt really prepared. I studied, I did questions, I relied on my faith, I said my prayers every day, So this video is getting kind of long. So I might have to try and edit it. I'm not really good at editing, so that's why most of my videos that I put up are not edited. They're just take them and bam. Just this is all me. I love YouTube because I'm making these videos, yes, to really help graduate nurses and maybe people who are in nursing school looking up Nclex if you're in your last semester of nursing school. It's to help other people and also for myself, just to look back on and to see how far I come as a nurse. If there's any other videos you want on me to do, I can do a lot of videos. Even if you're in nursing school, I can do videos about nursing school, about jobs, and I really want to do another video on my interview and kind of go more in depth on my questions and how I answered them, because that really helped me to get that job. I didn't do a follow-up. Maybe I'll do a follow-up on my job and afterwards and stuff, but that's all for today. This video is already going to be almost 20 minutes long, and I want to like fix it and see if I can play with my Windows Movie Maker or something. But that's all, guys. Have a Merry Christmas. I just went to the grocery store and it was crazy. I'm surrounded by presents right now. I need to I'm going to my mom's and taking some gifts over there, and tomorrow is Christmas Eve and family time, and yeah. So even if you are studying today, just take a break these next 2 days and just enjoy this time with your family. Because these times are so precious, and just cherish these times with your family. That's what I'm doing before I start working. So have a Merry Christmas, guys. God bless.